Dawn in the foothills of the Cascade Mountains, in the most remote reaches of East Linn County. Sunset on a breathtaking beach in Lincoln County. And in between, the mid-Willamette Valley, home of agribusiness, metal and wood product industries, and significant educational resources. The valley features lively medium-sized cities nestled among postcard-perfect covered bridges and small towns with close-knit communities. This is Samaritan Country. Samaritan Health Services focuses on improving the health of more than 250,000 people living in Oregon's mid-Willamette Valley and Central Oregon coast. Earlier in this century, community leaders in Benton, Lincoln, and Linn counties came together to establish a unified regional healthcare system. They understood that a shared mission and a commitment to cooperation, rather than competition, would strengthen and expand local healthcare options for their own families and their neighbors. Pioneer physicians, fresh off the Oregon Trail, were among the earliest settlers. They were prepared to pursue their calling despite the hardships. In every corner of the 3 counties lived horse and buggy doctors who visited isolated farms or boarded boats to help remote coastal patients in need, often performing surgeries on dining room tables or in hotel rooms. Some even opened their homes to pregnant women or patients in dire straits because there were simply no other alternatives. By the early 1900s, small hospitals had sprung up in Sweet Home in Lebanon, and the St. Mary's Rectory in Albany was repurposed for the same need. In Corvallis, a hospital was the initiative of 125 doctors and a handful of investors pooling their resources. Lincoln County doctors made good use of hot sea baths or former hotels to create sanatoriums and provide inpatient care. The doctors who controlled the small hospitals incorporated nurses and other support personnel to make their endeavors viable. The idea of a healthcare team was born out of necessity. But the contributions of support personnel became unmistakable in these earliest of inpatient experiences. By the mid-20th century, a generous public impacted by committed healthcare providers added funding and friendship to improve or rebuild medical facilities. Local champions stepped up as active hospital volunteers or investors and formed community advisory boards. Adding to this momentum were federal matching funds released after World War II to improve or create new hospitals. A frenzy of construction across the state also included local facilities in the 3 counties. In Lebanon, the Mennonite Church helped to finance, build, and manage a new hospital. In Corvallis, bonds plus assistance from the Episcopal Church established the Good Samaritan Hospital. Albany added a wing to its 1920s building, but later determined an entirely new building was needed, and all was accomplished within the span of 15 years. In Lincoln County, health districts were established utilizing property taxes as a funding stream to ensure that contemporary facilities would remain viable. New funding was followed by the advancement of healthcare administration theories and practice, and the region attracted new leaders who envisioned services and technology to take hospitals beyond general inpatient services, including 24-hour emergency services, outpatient surgery centers, home health and hospice, birthing centers to support shorter hospital stays, increased community health education offerings and support groups, excellent ancillary services, including clinical laboratories and imaging services, interdisciplinary cancer services, outpatient physical rehabilitation and sports medicine programs, mammography services and breast cancer outreach activities. Community advocates in Benton, Lincoln, and Linn counties also established stronger links with local hospitals and physicians to offer low-cost or free clinical services to low-income populations. Each of Samaritan's 5 hospitals can chronicle its caring service to the community, and the history of the not-for-profit regional network that is today called Samaritan Health Services is now more than 2 decades old. Born of a common mission to provide exemplary health care and keep decision-making local, Lebanon's Mid-Valley Healthcare and Corvallis's Samaritan Inc. were the first to merge in 1997 to form the not-for-profit Samaritan Health Services. The merger reflected the belief that integrated organization would serve their communities more effectively and efficiently. 2 years later, they were joined by Albany's First Care Health, which included a hospital, physician group, and outpatient services. By 2002, Samaritan expanded to include the Central Oregon coast. Samaritan now operates hospitals in Lincoln City and Newport, the latter of which is part of a long-term management contract with the Pacific Communities Health District in Newport. Both communities are actively working on construction plans for new hospitals, with Newport projected to complete in 2019 and Lincoln City in 2020. Today, the 5 Samaritan-affiliated hospitals, together with associated physician clinics and several health plans, continue to serve their local communities while working to build healthier communities together.